Good afternoon, welcome back. This is Saima. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to tell you about safeguarding. Someone requested this video if I can tell something about safeguarding, what is safeguarding and how we handle it in the hospital if there is a safeguarding issue, if there is someone raised a complaint, or if someone raised safeguarding concern. This is how we're going to handle in the hospital. In this video, I'm going to tell you all about this. All right, so first and foremost, if you haven't met me before, my name is Saima. I'm a nurse from Southeast England. On this channel, I provide information about UK nursing, how to become a nurse here in the UK, how can you pass your interview for healthcare support worker, for band 5 nurses or for band 6 nurses. I gave you all the tips in my previous videos. If you haven't watched those videos, please go back and watch those videos. And I also provide information about life, about my life here in the UK, what's going around me, inflation rate, housing, transportation, each and everything you can think of. You can find the information about that on my YouTube channel. So if you haven't subscribed, please do so. Let's start the video without any further delay. So first and foremost, we need to know what is safeguarding. Right, safeguarding means, as it says, safeguarding someone, protecting someone's health, protecting someone's well-being and their rights. It's called safeguarding. So by providing safeguarding, we make sure that someone lives a life without any fear, without any harm, without any danger, or without any stress. All right, so we hear this all the time in the hospitals. There is a safeguarding concern, there is some issues raised from this patient about someone's. So safeguarding means, if a patient says, I have, for example, let me give you an example for an easy understanding. If someone says that I don't want to see my son, I feel scared, or my son trying to steal my money, or if someone says he's so scary, so you need to find out what's the reason behind that words. If someone is saying, I don't like them, I don't like this person in my house, or so you need to know, you need to ask the person, why is that, what's the reason behind it. Maybe they have some safeguarding concern, maybe that particular person is dangerous for them, or they're trying to affect their mental health or their physical health. So there could be abuse, there could be any form of harm, there could be physical abuse, there could be sexual abuse, there could be anything like a threat or a fear from someone. So if someone's complain about someone in their house, or about their neighbors, or they know someone, they don't feel so if someone doesn't feel comfortable about talking about someone, if someone doesn't feel comfortable about telling you something about someone, so you need to find the ways how to ask that person why they're feeling this way. If they're telling you something about their son or about their daughter, about their neighbors, that they don't feel comfortable talking to them, or they feel scared talking to them, or they are hesitant to speak to them, so just make sure what's the problem behind it. Is there any safeguarding concern? Is there any threat to their life? Is there any threat to their social well-being, their mental health, or their physical well-being? All right, so you as a healthcare support worker, or as a nurse, or as a supervisor, it's your responsibility as a to confirm the reason, to confirm the issue, to confirm the problem. Or even if you are a doctor, you need to make sure that you are not ignoring that person, you are not just disregarding this concern if there is any about the safeguarding. All right, so you as a healthcare worker, you need to know what is safeguarding. Means protecting children, protecting adults, their health, their mental health, or there is if there are any other needs. So particularly when we work in the hospital, let's say if you're working in the medicine ward, medical ward, general medicine ward, you will be getting lots of patients with dementia, with Alzheimer's dementia, and also there are some patients who are under MCA, Mental Capacity Act. So if you're not sure about MCA, I can make a video about that also. So if there is someone under MCA, okay, you as a healthcare worker, you as a carer, it's your responsibility to protect their rights, to protect their health, to protect them from their relatives or from their neighbors or from a carer. So there could be anyone. Victim can be a patient, victim can be a healthcare support worker also. So you need to find out who is the victim, whether it's a patient or their relative. All right, so since you are dealing with the patient, so patient is your priority at that time. Their relative, if they come to the hospital and you are the carer, you can sort that out also, but here patient is your responsibility, patient is your priority. So you need to find out what's going on. Okay, so we say in the hospital all the time there is a safeguarding concern. When we take handover early morning or whatever shift you are on, when you get the handover, they also tell you about the safeguarding concerns. If there are any safeguarding concerns, you as a nurse need to know what are the safeguarding concern and who is the safeguarding concern. Yeah, so you need to, sorry about that. So you need to know if there is a safeguarding concern, who they are referring to, and against who. Okay, whether it's about their relative or a neighbor or anybody they are in contact with. Okay, so if you know if there is a safeguarding concern, sometimes what happens is that particular person, if you have that patient and there is a safeguarding concern about their son, now the son is calling over the phone and they want to speak to their mom, and mom doesn't want to speak to them because there is a safeguarding concern, there is a safeguarding raised about the son. So what you are going to do in that case? Okay, son is on the phone, son is saying I want to speak to my mom. Okay, and you as a nurse, you know that the mom raised a safeguarding concern against the son. Okay, just make sure it's the right son, because maybe if they have 3 or 4 sons, so you need to know. Let's say they raised a safeguarding concern against David, so you are going to ask, what's your name? You are not telling the patient, you are not telling the son that there is a safeguarding concern against you or something. You can tell afterwards. Let's say son says that I want to speak to my mom, and you say I'm so sorry, but mom is busy, or mom is not mom doesn't want to talk to you. You can tell that. And because if you say to the son that there is a safeguarding concern and you are a healthcare support worker, maybe it will not be convenient for you to explain to the son. It's best for you, if you are a nurse, you can speak to them, you can tell them that I'm so sorry, but your mom, she has raised a safeguarding concern against you. You can tell, because nurses, they can explain it better, they have more knowledge about the patient, they know the condition of the patient, and they have good communication skills to explain this situation to the relative properly. If you are a nurse and you are not sure how to handle this situation, you can tell to the supervisor that I'm so sorry, I'm not confident enough in explaining this situation to the son, or I'm not confident enough in taking this call. Can you please speak to the son and tell them that your mom raised a safeguarding concern against you, so you cannot talk to your mom. Okay, unless mom wants to talk to him. All right, so this is the thing. And also sometimes they have password also. If there is any danger to their health, let's say I have a patient and someone tried to threat him, or there is a threat issue or some danger to their health. So in that case, or there is any property concern, like if they have any lawyer, or there is any issue with their property, power of attorney, that was the word I was looking for. Okay, so in that case, most of the times the patients are password protected. If someone is calling over the phone and they want to speak to the patient, but patient doesn't want to speak to anyone, they said I can only talk to the persons who have my password. Okay, so you answer the call and then you say that you want to talk to this particular person, okay, and can you please tell me the password, and that person who's calling doesn't know the password, then you cannot give that phone to the patient. All right, so you need to know about these things. Okay, when you work in the hospital, when you go there, you will get to know all these things. But still, if you are listening to me, just make sure, if you are not sure about anybody, you are taking any call, you are not sure whether you should tell them that patient is all right or patient is sick, or if there are any concerns with the patient, if you are not sure whether should you tell them or not, better not. Okay, because it can be difficult for you if there is any problem, if there is any safeguarding concern, if there is any password protection, or if there is any other issues, or if there is a patient wish that they don't want to speak to you, and then patient, if patient requested, they don't want to speak to anyone, or they want their health to be kept secret, or they want their symptoms or their disease to be kept secret, and you over the phone telling to everybody or to someone can lead into a difficult situation for you. So just be careful. If you are a healthcare support worker, if you are a nurse taking a call, your phone is ringing, you are busy, you're doing your drug round, and you just want to get over with it, I would say hold on, let it ring, it's all right. Okay, if you don't answer, it's all right, unless if you don't answer, it's okay, but it's not okay to give false information, or it's not okay to tell them when you are not allowed to tell anybody. Okay. All right, so this was all about safeguarding. Safeguarding can be about children, safeguarding adults. They have their own rights, and we as carers, it's our responsibility to provide them that safeguarding, or to protect them. All right, also patient can raise a safeguarding concern about their carer. Okay, let's say I was very rude to the patient, and I said, can you take your tablet, or else I'm so sorry, I'll never say that. I'm sorry. So let's say you want to say if you don't take your tablet, I'll report you, or I'll beat you, or something like that. It's dangerous, isn't it? I feel scared even while saying it. So if someone, a carer, a nurse, a doctor, or a sport worker is saying that to the patient, um, or the nurse or staff is very rude to the patient, and the patient feels scared, and patient doesn't like to talk to that nurse, or to that doctor, or to that healthcare support worker, patient doesn't want to be with them, they can raise a safeguarding concern against you as well. Okay, so what will happen in that case? You will be having a discussion with your supervisor, or they can also make a formal complaint against you. All right, and it can also lead to a major trouble for you. The NMC can cancel your NMC pin if the situation is worse and you are not getting better. So just be careful. All right, so safeguarding concern can be against healthcare support worker, can be against a carer as well. So most of the times safeguarding concerns are raised when carers, like healthcare support workers or nurses, they go to patient's house, and if they neglect them, if they don't look after them properly, if they don't give them meals, or if they don't give them medicines on time, patient can raise a safeguarding concern. Relative can raise a safeguarding concern. Any of their relative can raise a safeguarding concern if they notice that you misbehaving with the patient, or you are not taking care of them, or you neglecting them, or you are not looking after them properly. Okay, so you just need to be careful with what you do, and what is your right, what is your responsibility, and what is patient right. Okay, so just be careful with everything that you do, and document whatever you do. Whether you give a glass of water to the patient, just document it, and also be careful, if patient is nil by mouth, don't give them water. Okay, and then you document it, I gave them water. If you did, just tell them and write that in the documents, that patient was nil by mouth, accidentally I gave water, or something like that. Whatever you want to say, just be honest, and document with they say if you don't document it, you did not do it. So documentation is way too important in everything that you do. All right, guys, so safeguarding children, safeguarding adults is a major responsibility for the carers. And if you see there are some signs that you can look for, if there is any bruise, if there is any cut, if there is any burn or something, just get into a deep discussion with the patient. Ask them what happened and why it happened, and how did you get this burn, how did you get this bruise. Okay, because you are the first carer, you are the first responder, and you will know it better. And most of the time when patient come to the hospital with a bruise, with the injury, or with a cut, or with a burn, you as a nurse or a doctor or a healthcare support worker will be there to handle that situation, and you should recognize it as soon as possible so you can handle the situation properly. Okay, it was a small topic, but I kept on going. All right, if you enjoyed this video, please give me a big thumbs up, and I'll try to make more videos. My baby is so much better now, so I have enough time to do it. All right, if you like this video, please let me know in the comment section. If you have any other questions for me, or if you have any other topic for me that you are not sure about, and you don't feel confident in taking care of those patients. Let's say we have patients with under MCAs or Mental Capacity Act, or patients under any section. Yeah, it could be a big topic as well. There are patients under section also, so you need to take care, you need to know how to take care of those patients also. Okay guys, so that's it for today. Thank you so much for watching. I'll see you soon in the next video. Till then, take care. Bye bye. God bless you all.